how to get into a health-related degree in room CG04 and an overview of the NHS in room C126 will start in 5 minutes. Thank you.
My name is Fiona Winch. I'm the manager of Barnet Education Business Partnership. We're a charity that works with schools and colleges on what's called work-related learning. And I'm working with Mandy Claret from CEPN on jointly organising this event. There's a real thirst for information from young people, students, their parents and careers advisors, how to get specialist information about careers that young people are interested in. Young people know about being a doctor or a nurse or a dentist, but within those fields they don't understand or are aware of all the different opportunities that are available.
My name is Caldwell. I'm the Dean of Healthcare Professions for Health Education England in North Central and East London, and we're the sponsors for the Barnet CEPN Careers event. This is an event, a careers event aimed at Year 10 young people from the Barnet area to trying to encourage them to come and work within health and social care. At the moment, they're asking me all about kind of what educational qualifications and what the universities offer in this area, and that's really brilliant, because what we're really keen to do is to attract local school children and encourage them to stay and study in London, because they're more likely to then go on to stay and work in London afterwards. It's a really positive event. The people from Barnet CEPN have been really enthusiastic about getting this together, because they're really committed to their local population and improving the choices for their local population. And I don't know that there's anything else like it, certainly not in the area. And actually it's attracted a lot of young people, and there's a very positive vibe around the event.
Grace Mahoney. I'm a clinical healthcare support worker, and I work at Oak Lodge Medical Centre. It's a GP surgery, and I started my apprenticeship a month ago, so I'm quite new. But so I do 6 months in a GP and 6 months in a hospital. So I'm in the GP at the moment. They asked me to come and talk, basically, to encourage people to do apprenticeships, because I'm really happy that I did an apprenticeship. I was going to go to uni, and then I decided, to be honest with you, I didn't know what I wanted to do, because you've got to be very specific with what you wanted to do. So I thought, I'll give it a try. I'll try the GP, I'll try the hospital, see what setting I want to do, and then I can decide. So that's why I'm doing the apprenticeship, and if people don't know what they want to do, it's quite a good way to go. So I'm talking to people, trying to make them understand why an apprenticeship's good.
So I'm here at Middlesex University as part of Anglo-Ruskin University, and my name's Joe Francis. I'm a paramedic, and I am here to promote the Paramedic Science degree, which I currently teach on. I also work part-time clinically, both for the ambulance service and for an urgent care centre in London. So in terms of who I've met here today, generally we've been speaking to students who are coming to the end of their GCSEs and are looking for a bit more direction as to where they want to go, particularly from an allied health professions career or for a medicine career. So we've been talking to a lot of students from secondary schools, also students who have been who are currently undertaking their AS levels or A levels and want further direction as to course entry requirements and what particularly Paramedic Science can give them in terms of a career and how they can move forward with the application process from there. In terms of the questions asked here, from our perspective at Anglo-Ruskin for the Paramedic Science, it's been a lot about what the role is of a paramedic. It's a vastly, generally not a very well understood practice, and a lot of people want to know what the day-to-day life of a paramedic is and how they can progress within a paramedic career. But a lot of what we're doing here is also promoting the university, promoting the different courses that we provide at Anglo-Ruskin from an allied health professions point of view. And the students have been asking how they can work towards that through their AS levels, choices, and general UCAS application. So a lot of good information that we're able to give them as Higher Education Institute. This is a really great event that we've held here today. It really allows us to again promote the paramedic profession, promote the university as Anglia Ruskin, but also to see all the other universities and institutes come together so that we can have a look at what's good for us in terms of promoting how students can access higher education.
My name's Karen Goodman. I'm from the British Association of Social Workers, and I've come to this careers fair today to talk to people who are thinking about going into social work, to tell them about the benefits of the profession, of the future, of how they can become a social worker, and how we work with other organisations. And we are the membership body for social workers, and we support students as well throughout their university career. Well, people have wanted to know about what the daily life of a social worker is like, so I've talked a little bit about the different forms of social work, children's services, older people's services, working with those with mental health problems, and I've talked about the kind of work that they would undertake and about the training process, because it's quite lengthy, and about the emotional resilience that people need to be able to go into this profession, and a little bit about the life experience that they need and the work that they can do before applying, because it's helpful if they can do some voluntary work as well. It's an excellent event. I meet people who are thinking about coming into the profession, and also networking and contacts with other local employers and groups and organisations in the area. So, for example, my colleagues in Barnet Social Services.